Welcome to this brief intervention program. It really is an opportunity to discuss our experience of staged care in the treatment of personality disorders. When clients come in crisis, they often see acute care services, and then many clients just need some psychological assistance to get back up on their feet, to reinforce some of the skills that they have, to give them some protective strategies to prevent them from coming back into crisis again, and really to help them integrate back into the community. So that's where the brief intervention program that we've developed is discussed today. Here we have clinicians describing their experience of setting up this staged care, the brief intervention model, how it relates to the acute care services, and how it relates to the longer term treatments.
The brief intervention is beautiful for changing, risk management into a therapy approach. So as a brief intervention, offering 3 or 4 sessions that focus on practical skills that the person can actually use for the situation that they're in, and drawing together, in the presence of a caring other, their existing resources, assisting families as well to have some information and provide support for their family member.
People could present in some kind of crisis. They were literally given a gold card. We went with that. We kept up a roster, and you were on the roster. You didn't have to be a crisis team worker. In fact, our brief therapists came from the other community teams, certainly initially. And basically you're on a roster, and if somebody, so for me personally, I think I was on twice a month, a Monday and a Thursday, twice a month, then I just went to the counter at that time and saw if somebody showed up looking confused and carrying a gold card, and if they did, I registered them. We got going. So it was very simple, which is one of the beauties of this service. I actually think it's such a simple and robust kind of process. You present in crisis, somebody gives you some encouragement, gets you through, gives you this thing. If you can find your courage and show up, there's somebody who just smiles at you and gets working. And it's probably a lot more simple for getting help and support for people than a lot of other processes.
I like the brief intervention because it offers an immediate treatment source for people presenting in crisis, and quite often in the public mental health system, understandably, we've got wait lists, and we don't always have available resources, so things can be 1 week, 2 weeks, 4 weeks wait, whereas with the Gold Card Clinic we have 2 standing appointments all the time. So we have one on a Monday at 11 and one on a Thursday at 11, so we can immediately offer an appointment to someone without having to check or to wait until the weekend's over. So I really find that's helpful. I also find it's helpful because it's manualised as well too, so once you've done the Gold Card Clinic a couple of times, you don't really have to prepare as much as well too, so you've just kind of got a formula in your head. You go in, you do the survey, you talk about the crisis, and you're working on the care plan. So in a way it's quite easy as a clinician as well too. You can walk into it and without a lot of preparation once you've done it a couple of times.
Well, I think you need a coordinator. You certainly, I think, need a consultant, and otherwise it's clinicians, and that's pretty much it. And our consultant really is available for those, fortnightly consult meetings, and also, I guess, if there's something that I feel like I can't answer, that I need that extra support as well. So I'd say coordinator, consultant, and clinicians.
The coordinator is not just somebody who kind of keeps the stats. They've got to think a little bit strategically. They've got to think a little bit about the motivation of the people that are coming along. Again, it's context dependent, whether you'd have a team leader do it or it's just somebody's job or whatever. But whoever does it's got to have some sense of feel for people and for how people progress, and for the fact that people, you know, have, the clinician fraud syndrome and all that kind of thing, and need a bit of encouragement.
There's lots of strengths with the brief intervention. I really like the structured nature of the whole model. It focuses on like recent events for the consumers, which is often what the consumers want to talk about. They don't want to talk about what's been going on for them years and years ago. They want to focus on what's brought to this crisis, and it also provides a lot of tools and strategies for the consumers to take away. It empowers them to kind of take control of their what's going on for them, and provides lots of tips to do so. It also includes the families and carers, which is great to see that it's not seen even in a brief intervention, that's not kind of disregarded.
Some of the things that clients say the most is that they find it helpful because we can immediately offer an appointment, and when people present in crisis they're really wanting something tangible, so people find it very helpful to be given an appointment card and say, look, you know, we can see you again in 2 days. I think they also like that it's very practical as well too, and can take away a care plan. And sometimes when people have completed the brief intervention and then they might call the acute care team back a month or 6 months or a year ago, anyone can prompt the person and say, look, do you still have your care plan? Or we've got a copy of the care plan on file, and actually go through the strategies, go through the early warning signs, and then they don't feel like they have to start their story all over again. It is very practical based, because lots of the time people in crisis will say, look, nothing's working, I don't know what to do. So it's very grounding to have a piece of paper and say, try A, try B, try C.
The Gold Card Clinic can be a referral pathway to longer term treatment as necessary. And so I guess it really provides both. It's not like we lose the longer term treatment options. But I think that the Gold Card Clinic is really a better treatment option for those people that research tells us are just going to need 3 or 4 sessions in a situational crisis, and actually not require further intervention, longer term intervention right at the moment. I think also it actually puts a warm and human face to a first-time user of services. It introduces the idea of a therapeutic approach, and I guess because built in to the brief intervention is that idea of ongoing referral pathways as needed.
I was sort of concerned at that time about workload primarily and what that would mean for myself and the DBT team that existed, and then also around really whether the service would actually help clients that have these personality disorders or traits, because I guess these are, you know, chronic long-term conditions. So, what I found though is that in terms of the treatment, I think there has been such a gap between, or for those people that are presenting in crisis, and between those people getting treatment and appropriate treatments. So I think the BLIP program services those clients. They feel like they've been, they've been taken seriously. They're being listened to about what it was that happened for them, and then being given some skills to sort of get them back on track. And I think the feedback has been really good in that regard. And in terms of our clinician workload, certainly I think, when people, we've got about 10 clinicians on our team, and everyone, is asked to put their name down per week when they're available. So I don't think it has added that much in terms of workload for clinicians. So I guess my fears have been allayed in that regard.
I've worked in community mental health for a number of years, and so I provide longer-term interventions for people, for clients. And when I first came into the brief intervention, it was a cultural shift for me, I guess. It was a real shift for me in terms of my approach, and I realised that I don't have a real lot of time here to be working with this person in front of me, but I still want to be hearing them. I want to be present. I want to validate. I want to be empathic. I want to be able to teach them some skills as well. I don't want to just be responding to a crisis presentation. And so it was a real like, okay, how do we get what we need to get done in three sessions, 3-hour sessions, hourly sessions. So at first it felt strange, but it worked. It works really well. And what I've found is that my approach in the short-term interventions has actually helped me in my longer-term treatments as well. So I sometimes think, okay, there's some things that we need to get done in this session today. This is in the longer-term treatment. What do I need to move toward? So brief intervention has influenced the way I work in longer-term treatment. Longer-term treatment has somewhat influenced how I work in the brief intervention. And what I mean by that is that thing of empathy, validation, active listening skills and teaching skills, etc. It's all doable. It can happen, whether it's brief or longer term.
I think the intervention fills a gap for our service. So certainly there's been clients historically that have presented to the service, with suicidal self-harm behaviours or in crisis that were not seen or followed up. And so, at least in this program, we offer them a service once they're presenting that they can be seen very quickly. They can be taken seriously in terms of what's happened. They can be offered, some skills or some things to get them back on track very quickly. And we find the results of doing that very, very effective. So I think it's offered a nice, and it's allowed our program, because I work on the DBT program as well, to, I guess, orient those people that we feel might be appropriate for our longer term treatment to talk about the diagnosis and orient them to longer term treatment options and then get them assessed for that as well.